In earlier days, getting treatment for an illness at a hospital was deemed a privilege for those who were well off. However, in this day and age, with the increased availability of medical services, Taiwanese residents can easily seek medical treatment. Moreover, TIMA's free clinics for needy residents in remote regions have had to transform as well. In today's TzuChi's 50th anniversary series, we take a look at how TIMA's free clinics have adapted to changing times.
These cries of help are often heard from seniors in remote areas, but it's really no longer due to lack of access to medical services. This is an era where national health insurance and medical service networks are widely available in Taiwan.
In these past couple of years, medical service networks have matured, and the national health insurance has become better.
Taiwan is such a fortunate country. I think in this day and age of our medical care, there are very few areas across the island that lack access to medical services.
Even residents of remote areas have national health insurance. It's just they don't have easy access to see doctors. However, they often receive more medicine at a time when they do see a doctor. There seems to be very few places where free clinics are absolutely necessary.
TIMA was established in 1998, and 10 years later it was facing restructuring.
Large hospitals, teaching hospitals, and others began to adopt remote villages to safeguard the residents. If TIMA clinics gave them more medicine, then the medication for the patients is redundant.
As free clinic patients in remote villages decline, medical volunteers look for new ways to safeguard residents' health.
We began to visit patients who can't leave the house through local volunteers' referrals. We then establish a patient file for each resident.
Though there's no room for us to hold free clinics, we continue to adapt to the changes of time, as our main goal is to spread compassion and humanistic care.
This is the evolution of TIMA, caring and friendly doctors.
I'm no longer bound by clinic hours. I can see the patients at ease and further understand their condition. I can get to know what they eat daily and what their home environment is like. And this is a totally different type of patient-doctor relationship for us.
Getting to know the patients on a more personal level, medical volunteers' senses are sharp.
30 pills a day. How can you take 30 a day? You're full on pills alone.
We are here to teach them. We check if they are taking their medication correctly. This is how TIMA continues to evolve.
Though TIMA's free clinic services continue to change, what hasn't changed is the way doctors care for the patients.
The doctors have taken care of the Lee family one generation after another. Now that my husband's grandmother has passed away, you're still here taking care of my mother-in-law.
I had a drink right now. I don't stay away from anything. You have to prescribe the right medication. Don't get me the wrong ones. I drink, I chew betel nut, I consume it all.
One can't help but shake one's head at the good nature of some of these residents. For the past 18 years, stores like that and more have fueled Tzu Chi's medical volunteers.